We reverence the Lord and we acknowledge him for who he is and what he is continuously doing for us. I acknowledge the presence of our Chief Nursing Officer, Ms. Jason Campbell Hannibal, our Chairman, Bishop John I.C. Klein, executive members and fellow co-presenter, Ms. Angeline Q. John, our Financial Controller, staff, and of course, the media present with us. How fitting for us to start this press conference in the chapel of the New People's Hospital after the transition on December the 29th, 2014 of our clinical services. The purpose of today's press conference is to present the BVI HSA's position after receiving cabinet approval of the new fee structure, the categories, and the criteria for the British Virgin Islands Health Services Authority that took effect on Monday, the 12th of January, 2015. The British Virgin Islands Health Services Act of 2004, number 14 of 2004, has been amended, and the BVI HSA is presently governed by the hospital regulations of 2014. This press conference provides the public, through the forms of the media present today, to hear the position of the BVI HSA as it relates to the new fee structure. The timing for this press conference is 45 minutes. A press advisory has been sent to all media houses and outlets yesterday, the 14th of January 2015, with electronic copies of the hospital regulations of 2014, which will serve as material for discussion during today's press conference. The general public is welcome to visit the BVI HSA website at www.bvihsa.vg to view the copy of the legislation. The agenda is as follows. We'll have a statement by our chairman, Bishop John I. Klein, with a statement on the context of the purpose of this conference. We'll have questions through the moderator to be fielded by myself and the financial controller through the chairman, and we will close with a statement of record for the BVI HSA. So without any further ado, I call our chairman, Bishop John I. Klein, to the podium.
Thank you, Madam CEO, for the introduction, and good morning to everyone. I will read a statement and then we will proceed from there. There's no doubt that from what surrounds you and what you've seen in the last couple of months that we are very serious about providing the best healthcare possible in the territory and in the region from Peebles Hospital. It is important to note, however, that for more than 40 years, medical services in the territory have remained the same, while the cost for providing those services has significantly increased. For example, while inpatient room cost per day remained at $25, the average cost per day for government hospitals in the region is around $1,100. In our neighboring St. Thomas Island, costs for a semi-private room is about $1,175, and in Anguilla, it is quoted at $375. Our rate is still cheaper, and it comes in at only $225. Many government administrations in the BVI have left the cost of health care low, and they have done that by subsidizing it very heavily. However, this is unsustainable. And really, if we are honest with ourselves, it is a threat to our national economic security. Therefore, in order to sustain the healthcare needs and provide the services necessary, this administration have developed and implemented the National Health Insurance System, which we hope will be implemented very soon, because it is one of the ways we hope as an organization to survive. Out of necessity also, in recent months, legislation has been passed to increase healthcare fees, and they have been implemented. Now, while that has been done, we understand that the public has some concerns about the increased fees, but we want to assure the public that no one seeking health care at People's Hospital will be turned away because of their inability to pay. However, it is important that those persons who have health insurance that pay for health care services, primarily they use it for paying for health care services overseas, that when they come into our facility, that they present their health insurance cards. These insurance providers, I think, are very happy to pay our fees versus the fees that they have to pay overseas, because the overseas fees are much higher. So we are confident that the health insurance providers will have no problem paying our fees. So it is our position that not only are the fees justified, but the fees are very, very necessary. If we are going to help this territory succeed in providing the best health care possible, and to prevent our people from traveling to our neighboring islands and the United States to find health care, these fees are of a necessity. It's not because we want to make a great profit. It will not help us to do that. But what it will do is help us to cover our cost to some degree, not even fully. So it is with that in mind, these fees are implemented, and we beg for the public's patience and understanding, knowing that at the end of the day, it will serve you very, very well. Thank you.
I take pause to acknowledge the presence of our board member, Mr. Lemuel Smith. Thank you. So within the context of the spoken position from the BVI HSA, given our recent occupancy to the New People's Hospital, we appreciate the understanding of our patients and their families as we move forward to build a more robust healthcare system. Even most recently, we have received communication from patients and their family with their willingness to comply with the new fees. In several instances, we have been approached by persons who have received services more recently from the category formerly known as exempt, who have volunteered and presented themselves to make payment of their medical bills. The public is advised of the categories as it relates to those that have been relatively unchanged, noting the elimination of the category of the mentally ill, which will be assumed under another category. The former category of mental illness is included again in another category, so relatively remaining unchanged. The criteria has significantly changed, as well as the payer for services rendered has changed. Particular attention is being brought to our most vulnerable population, the elderly and children. The category of 65 years and older remains unchanged, but there's an explicit criteria that anyone in this category must be uninsured or have no insurance and be a belonger or a resident for more than 10 years. The payer for this category of 65 years and older will be the Ministry of Health and Social Development. The category for dependent children has been clearly defined in the initial portion of the document. Again, they too must have no insurance, the residency status applicable under the definition by parent, and years. And again, the payer for this category will be the Ministry of Social Development. I acknowledge the presence of our Deputy PS from the Ministry of Health and Social Development, Ms. Carolyn Stout-Igwe. Thank you. So without any further ado, in the essence of time allotted, which was 45 minutes, we open now to the media for questions.
Good morning, Monica McPherson, the Summer newspaper. This is Carty Baptist. Let's just go back to what you just said about the persons who were previously exempted, but now will have to pay. I think there's been some confusion with the public regarding this, because prior to the change, there were calls for some persons who were exempted to pay, and now I think there's a misunderstanding. So if you can clear that up, we'll appreciate it.
I'll go through the categories referenced in the document that was referenced before. The person 65 years and older.
I think I should be specific. Previously, there were concerns, I think, in the public in terms of, I'm not sure, I'm subject to be corrected, police officers were previously exempted and others. So I think that's what we're wondering right now. The exemption, does it still include some public servants?
The categories have been reestablished. So the 65 years and older, indigent, wards of the state, persons under the reciprocal health agreement, the contract, prisoners and dependent children. All other categories are no longer considered exempt. Does that answer your question? Yes. Okay.
And understand why that is, because all government employees are covered under insurance policy. I think it's BUPA. So the way it was before was they had insurance, but it was never used in our facility because of this exemption. And we think it's a bit unfair that people having insurance can go overseas and use the insurance card, and we are exporting the money, but when they come to this facility where we are providing a service, they have no obligation to pay. That has changed. As long as you have insurance, you are expected to present your insurance card, and the insurance will then becomes the payer of the claim.
If you don't mind, Crystal Cannon from the Beacon newspaper. I just wonder, I know that you all have been talking in principle about raising these fees for some time, but why not, last month when we were all paying a lot of attention to the new hospital, why not also say, just so everyone knows, this is what's going to be happening. If you have insurance, come with your card. Why not give people some advance warning?
I think there was ample warning. We've been saying it over and over again. We have been encouraging people to bring your insurance card, even if you're over 65. Bring your insurance card. So we have been saying it. I don't know if people have not been hearing, but hopefully they will hear now.
Mr. Klein, I'm sure you're expecting this question, but at any time did the BVI Health Services Authority encourage persons to sell their land or do whatever they need to pay the bills?
Absolutely not.
But just a follow-up, where do you think this is coming from? Because there are some persons who are trying to say to the contrary. I'm sure you know it was out there and it was made public, but persons are on the blog saying that they were actually asked to pay.
I would like persons who have been asked to sell their land to pay for any type of outstanding bill to come forward and present themselves. Other than that, I have no knowledge of us asking anyone to do so, and I have no knowledge of anyone who have done so. So if they're out there, they need to come forward. Other than that, I just consider it rumor and propaganda.
I'm Kathy Richards, Virgin Islands News. Just to follow up on the very question that my colleague just asked, has there been any attempt in any way to recover monies that are being owed to the institutions? Can you explain if there is, or?
Yes, yes. We are in the process of trying to recoup the 20 or so million dollars that has been owed to this organization over many, many years. And we are doing it internally, and we're doing it externally. We've hired a bill collector to help us to collect outstanding debt, and we also do it internally. So yes, efforts are being made, but this is not something strange. It's done all over the world, that if you provide a service, you're expected to pay. You promise to pay, but you don't pay, then we come knocking on your door and ask you to pay. I don't see what's strange about that. The BVI seem to have some kind of a...
Was this the first time that bill collectors went out on behalf of BVI agency?
No. No. I think we are more organized in doing it now. You know, maybe in the past it was a bit ad hoc, or as we had the human resource. But now it's more focused, and it's more organized, and we intend to collect money.
Okay. Are there penalties for persons who consistently refuse or not fulfilling their obligations?
We can take them to court.
Just another follow-up on the bill collection situation. And I'm just bringing some of the questions that are there in the public. One of the things that persons are wondering, you mentioned the large figure of how much is owed right now, the millions we're saying. And the question is, how did it get to this number? I know it is before your tenure, but I'm sure the information is before you. And if you can give us an idea, roughly, because I know you can't be specific, what do you think is the oldest old bill?
Angelina John, Financial Controller. While I cannot state the exact year, I can tell you it is several years. And the maximum outstanding from any one individual at this point is $185,000. And we have referred 25 persons with a total of $2.3 million to the external debt collectors. And what we are asking is these persons meet with their debt collector and at least make some agreement to make some notional contribution on a regular basis to settling that debt. But you have persons who just don't turn up at all, even when they're contacted. So these are the persons who we will probably be seeking legal action against.
And let me make it clear that some of these persons have signed agreements that they will pay. We have guarantors of these agreements. And most of this cost is not local for us, you know. The money is not coming to us or had not gone to us. It's gone to the overseas providers when we had to fly them out, because their family's life was at risk, and we took what monies we had upon their approval and their agreement and shipped them overseas. And these people, whether it be Miami, Baptist Hospital, Jackson, HEMA in Puerto Rico, they come knocking, Pavia, they come knocking for their monies. So the money is not coming to us. The money is going to these people that we have these relationship with, that are owed the money when their families was near to death's door.
That's a question. Okay.
Yeah.
Along the same line, good morning, Gordon French, B5 Platinum. As a debt collector written to those who owe money, requesting financial information such as estate information, bank account information, have you done that? Can you say?
Well, it's standard collection practice that you would seek that sort of information from anybody owing. And this is the means by which you would be guided to establish a sort of payment plan based on what their available disposable income is. And that is with that in mind that the debt collector has requested that sort of information.
So you could understand some of the confusion when they say that you might actually go after the lender.
No, one is not linked, well, probably, but it's not directly linked to the other. It's just a means of establishing your ability to pay and how much.
Okay, and the debt collector, could you say if you have a signed contract with?
He does have a signed contract with the BVI HSA.
Is that a law firm or is it a?
It's a debt collection agency.
Okay, what is your relationship with Orion Law and Zulfa Cooper?
Zulfa Cooper is the external debt collector. Orion Law provides occasional legal advice.
If I could get back to the fee increases, I want to know what kind, I guess this is going to be for you, Ms. Chan. I want to know what kind of a dent that's going to make in the finances of health services.
Okay, at the moment, the fee increases will not necessarily close the gap between our total expected revenue and our expenditure. For the budgeted year 2014-2015, we expect to realize revenue of $16 million. That's with those fee increases. And government has approved $24 million for the Health Services Authority. If you do the math, this is about $40 million. And our expected expenditure is $45 million. So there is still a $5 million gap that we need to close. Well, right. There is still a $5 million gap that we need to close. And the major part of you would see, and last year, our total expenditure was $30 million. You would see the significant jump with the transition to the new hospital, $15 million. A lot of it will be in human resources, so we can control the way persons are recruited so that we can control this $5 million gap.
Any ideas or any plans on what measures you might be taking to try and bridge that gap besides the human resources management?
The primary focus is human resources management. What we're looking at strengthening our current workforce, training up persons in certain skill sets, job shadowing, job sharing, expansion of services. Again, looking at the revenue base, those service line items that we currently have that we're not, again, meeting the cost. So that is one of the areas. And I think we're really good position right now because even this week we were able to introduce our dialysis technicians into the service. Again, they're meeting a gap where we were going to hire 4 nurses at a certain threshold. We have a quarter of the cost if we use a dialysis technician instead of using registered nurses for those posts. So as we go by service, and again, looking at introducing new services, and again, increasing revenue for the organization.
I know it's true in other industries that oftentimes it's much more cost efficient to train up persons that you already have versus bringing a brand new person.
Yes. So that's part of the workforce development.
I don't know if you spoke to the issue of strengthening the internal system, because I know in the current outstanding monies you have on the road, some persons have claimed to have paid, and then there is some confusion back and forth as to who's paid or who's not paid. How have you dealt with improving your systems internally?
We've implemented a new health information system, albeit that that system has not been fully integrated with the accounting system. But right now, our numbers are more up to date, and we are working to try to regularize our accounts receivable. We acknowledge the fact that at this point, there is some confusion with payments from many years ago. But as we approach the persons, if there is any amount that they think they have paid and is not recorded, we ask them to bring in the supporting documents, and we give them credit for it accordingly.
Okay. Yeah. I think it's important for, and this is what we keep stressing from an organizational standpoint, from the board on down, that fulfilling the vision of the Ministry of Health and this organization is to provide excellent care and make as much as possibly can all specialties available in the BVI to our people. We believe that in doing so, it will save the population a lot of money from shipping them overseas. So when we go out and spend a couple $1 million almost on an MRI or a CT scan. I was in St. Kitts over the weekend. They don't even have a MRI. Anguilla doesn't have an MRI. But we do. And providing these services costs money. It costs money to buy the equipment. It costs money to maintain and own the equipment. It costs money for the technicians operating these equipment. All of these things cost money. So, but we're making these services available to our citizens and to our clients. And it is that kind of services, these kind of services that's driving the cost of healthcare. So they don't have to take a plane, go to Puerto Rico, spend days in a hotel, pay the accelerated cost of healthcare that is normally associated with living in the US. And you can get it here in the BVI for a fraction of the cost. And I think that the BVI really and the public should really become appreciative of what the efforts that the Ministry of Health is making in trying to provide services here in the BVI. So whatever confusions there are, we hope that we can clarify them. But not raising fees is not an option. Before we did this, I must tell you that this government was reluctant to do it. But we had to go in, we had to sit with them, and we had to show them. The bus is sliding over the hill. It gonna collapse. It's crashing. This is not sustainable, right? And after we made the case and we showed them the case, then reluctantly, because they're politicians and they care about their people and what their people feel. But the truth of the matter is, what is the alternative? Leave things as they are and let them fly off to Puerto Rico and fly off to the US and find health care there and pay this astronomical cost of hotel and airfare and come on. There must be some type of appreciation for the efforts being made here and this wonderful facility that has cost us millions of dollars. I think we're on a good track and we started a good thing. And I say like Nehemiah, we are doing a good work and we will not come down. Amen. Can I get an amen?
Thank you. This concludes our press conference. Everyone have a wonderful day, and remember that only excellence counts.